So, good evening students, welcome to Bajirao IAS Academy, the Hindu news analysis. Today is 7th September 2024 and today we have some important articles from different newspapers. So one by one we'll try to discuss all these important articles, and before discussing them, yesterday we have given one prelims practice question and we'll try to solve that particular prelims practice question. The question is, which of the following is the first state in the country to enact a legislation to increase the marriage age of girls to 21 years? And in fact, this is Himachal Pradesh, and in fact Himachal Pradesh is the first state in the country to enact a legislation to increase marriage age of girls to 21 years, and it is a move from the Himachal Pradesh state government to essentially bring the age of marriage of girls at par with men, and also an attempt to ensure a greater gender equality. So the correct answer for this question is Himachal Pradesh, and you can also go through the explanation part of this. So Himachal Pradesh is the first state in India to enact legislation raising minimum marriage age of girls to 21 years and passing the prohibition of child marriage Himachal Pradesh Amendment Bill 2024 in their state assembly. This will be one of the important question, so you have to remember this particular state and increasing marriage age of girls to 21 years by the Himachal Pradesh state government. And in fact, so there are demands of increasing marriage age of girls to 21 years, but Himachal Pradesh has taken up this initiative and it has become the first state to do so. If it is successful, and if it leads to a significant improvement in the conditions of women, so then other states would also follow the Himachal Pradesh in terms of increasing the marriage age of the girls to 21 years, bringing this age at par with the men. And today we have another current affairs based prelims practice question. The question is, recently, India has completed a successful test firing of Agni-4 ballistic missile, and consider the following statements regarding Agni-4 ballistic missile. The first statement is, it is a surface-to-surface missile. Second statement, it can hit targets of up to 4,000 kilometers range. And third statement is that Agni missiles are designed and developed by Defense Research and Development Organizations, which is also called as DRDO. So which of the above statement are correct? So select the correct statement and also comment the correct answer in the comment section, and correct answer we will be providing you in next class. And one by one we'll try to discuss all these important articles, and along with these articles we also have a mains practice question, right? So which is also based on newspaper article. So therefore we'll try to discuss this first article. It is a National Tiger Conservation Authority letter on relocation from tiger zones, right? So in fact in India we have a Wildlife Protection Act of 1972. So when this Wildlife Protection Act, so I hope all of you knew about this Wildlife Protection Act 1972, and when this Wildlife Protection Act was passed, Project Tiger was started for arresting the declining or dwindling numbers of the tigers in India. Project Tiger was started, right? So the objective of the Project Tiger is to stop or to arrest the dwindling or declining number of the tiger populations. And as part of this Project Tiger, every tiger reserve is divided into the core area. So there will be a core area with no disturbance or minimal disturbance, and surrounding core area there is also a buffer area. And in this core area human activities are completely prohibited, right? But on the other hand, the human activities in the buffer area are regulated, not completely prohibited but regulated. But still there are a lot of tiger reserves across different national parks in the India, so where a number of tribal communities are still living in this core area. Now human activities in core area would very often causes disturbance to the tiger population, right? So it also increases a human animal conflict. Human animal conflict is another major concern. right? So because of that reason, and in order to ensure better survivability of the populations of tigers, National Tiger Conservation Authority, which is a legislative body and it was established under Wildlife Protection Act of 1972, so actually sent a letter on the relocation of tribal communities from the tiger zones and communities specially living in the core areas of these tiger zones, right? So but it is not that easy, because displacement of tribals from their core area or from their indigenous habitat, that would lead to the violation of tribal rights, right? So therefore there's an inherent conflict between the tribal ministry and also the environment ministry. So that is the cause of concern in this article, and the context is that National Tiger Conservation Authority, which is also known as NTCA, National Tiger Conservation Authority, is a legislative body, or it is a statutory body, and the statutory body which was established through Wildlife Protection Act of 1972, and the responsibility of the National Tiger Conservation Authority is to ensure the optimum level of tiger populations and also address the threats that tiger population have been facing. So this National Tiger Conservation Authority, which is considered as apex body and which is also tasked with the conservation of tigers, asked 19 states to immediately prioritize the removal of villages or the tribal communities in the core tiger zones, and it has actually resulted in a conflict, or it has actually drawn an ire of several organizations and activists, right? So I hope you have understood about this. And in fact, around 591 villages have been comprising around 64,801 families, and 64,801 families are still living in the core area of the tiger zone across different tiger reserves in India. However, as of now, the progress of a village relocation or relocation of the tribal communities who are living in the core area of the tiger reserves, the progress is very, very slow. And in fact, the slow progress in the relocation of the tribal communities who are living in the core areas of the tiger reserve poses a great concern in the light of tiger conservation, right? So it would also impact the tiger populations, and it would also result in a very frequent man-animal conflict, and even that would lead to the death or killing of the tigers as well. And in fact, Karnataka has around 81 villages in the core area, one of the highest, with 1,175 families have been relocated since the inception of the Project Tiger in the year 1973. So since 1973 Project Tiger, only 1,175 families have been relocated from the state of Karnataka. So you can imagine that the progress of relocating villagers or the communities who are living in the core area is very, very slow in its progress, right? So in this context, what is the core area? So as I have already told you, that every tiger reserve has a core area with a minimal disturbance or no disturbance or no human activities at all, because all the human activities in the core area would be completely prohibited. And then there will be a buffer area, and in this buffer area all human activities not necessarily prohibited but rather regulated. And core area or core zone actually refers to the portion of tiger reserve where tribals cannot live, and the human activities such as hunting, collecting forest produce is strictly banned, and that area is known as the core area of a tiger reserve. And in fact, there is a concentric circle, and this is the concentric circle outside the core area, which is called as the buffer zone, where the restrictions on human activities are being imposed and they are being regulated, right? So they are lesser restrictions, but these restrictions in the buffer area are regulated, rather not completely prohibited like the core area. And in fact, there are 53 tiger reserves in India across 19 states and 848 villages comprising 89,808 families in the core zone across India. So however, since 1973, ever since the Project Tiger was first launched in the year 1973, 257 village comprising 25,007 families have been relocated so far. However, the core zones of tiger reserves are very often considered as inviolate, and these must be made so by coaxing residents to voluntarily relocate on mutually agreed terms and conditions. So therefore, it will be a win-win situation for the tribal communities and also for the conservation of the tiger populations, because lack of this less human activities means lesser disturbance to the tiger populations in sensitive and core zones. However, the relocation of the forest department communities or forest dependent communities is a flagrant violation of the all relevant laws. And what are the laws which are being violated by the displacement or relocation of the tribal communities? And in fact, this National Tiger Conservation Authority's relocation orders were in or complete violation of the Wildlife Protection Act 1972 and the Forest Rights Act 2006, right? So we have Forest Rights Act as well, and then we also have the Right to Fair Compensation and Transparency in Land Acquisition and Rehabilitation and Resettlement Act of 2013, and even Scheduled Caste and Scheduled Tribes Prevention of Atrocities Act of 1988. So the relocation orders of the National Tiger Conservation Authorities have been violating all these legislative enactments. So therefore, it has to be seen how the core zones would be protected, because protection of and conservation of tiger populations is very, very important, because of tiger is one of the flagship species, and it is also considered as a keystone species. And declining tiger populations due to increasing human activities would not be considered as a good indicator for the environmental sustainability and environmental health. And because of that reason, the National Tiger Conservation Authority's objective is to reduce the human activities in the core area and also ensure that the sensitive nature of this core area can be maintained by relocating the tribal communities and the villages who are located in the core area to other villages. And in fact, the National Tiger Conservation Authority's action put pressure on the respective state governments, and because of this pressure from the National Tiger Conservation Authority, state governments have been trying to relocate communities using force as well, and state governments very often committing illegalities, and which is very often in violation of Scheduled Caste, Scheduled Tribes and Prevention of Atrocities Act of 1988 and Forest Rights Act, Wildlife Protection Act, and several other legislations which were previously passed. And in fact, this would, or the displacement or the relocation of tribal communities would even lead to the massive conflicts between state authorities and scheduled tribes and other forest dwelling tribals living in the tiger reserves. And in fact, the process of relocation is voluntary and cannot be done without settling the rights of the forest dwellers. So all these things have to be looked into very, very clearly when it comes to the relocation of the tribal communities, because it would amount to the displacement of the tribals and rehabilitation and resettlement issues, and tribals losing the traditional rights over the land and other natural resources. So these issues have to be properly addressed before relocating the tribal communities who are living in the core areas. Rather, they should be relocated to the buffer areas in a sustainable manner with much progress. Right, so that's all in this article. And next article is with respect to the multi-drug resistant tuberculosis. So we very often discussed about this multi-drug resistant tuberculosis, and it is also very important for your prelims examination, and with respect to your mains examination, particularly general studies paper 3, this topic would be very, very important. In science and technology part, you could be asked multi-drug resistant TB, and even social justice section, especially the vulnerable communities. You may get this question in the general studies paper 2 as well, right? So prelims and even mains also, multi-drug resistant TB or tuberculosis as a disease is very, very important. So let's try to understand the context of this article. The context is that Union Health Ministry on Friday approved the introduction of a new treatment regimen for multi-drug resistant tuberculosis. Now what exactly is this multi-drug resistant tuberculosis? Now I will explain you. Tuberculosis is a bacterial disease which infect lungs in human beings, right? So it is a bacterial disease which infects lungs, and in fact tuberculosis is very often considered as a chronic disease, or it is a long-term disease. However, with respect to TB, since it is a chronic disease and there is no proper diagnostic techniques or diagnosis takes time, generally what happens is that and even because of the poor healthcare infrastructure that we have in India, so all these problems have been making that the TB bacteria has been developing drug resistance against the existing drugs which are used to treat the tuberculosis. Now what does it mean when any pathogen has been developing drug resistance? The ongoing or the existing medicine would become ineffective even if the patient spends a lot of money on purchasing drugs. So those drugs would be simply ineffective because the pathogen has already developed the drug resistance. So since tuberculosis is a chronic long-term disease and patient needs to use this medicine for a longer duration or longer periods of time, when patient stops using this medicine and over a period, or even patient using over medication more than what prescribed by the medical practitioner, so all these things would over a period of time lead to developing of resistance by the TB pathogen, and this has happened with the tuberculosis, and now tuberculosis has become a multi-drug resistant. It is resistant to multiple drugs which are being administered to treat the tuberculosis. So this is certainly a cause of concern when any pathogen becomes resistant to the medicine that we have been taking. So that would lead to the increased mortality of people and increased infection rates and burden on the existing healthcare infrastructure, and even more and more people would get infected with such diseases. And therefore it is very important that India, with a huge population, we need to deal with this multi-drug resistant tuberculosis, and that is the reason why the Union Health Ministry on Friday approved the introduction of a new treatment. So there will be a new treatment to this multi-drug resistant TB tuberculosis in India. And before discussing that new regimen treatment of multi-drug resistant tuberculosis, so we will try to understand some data, some facts with respect to the tuberculosis. And in fact, every day around 3,500 people die from tuberculosis worldwide. Now remember that whenever you present such data in your answers, so your answer would look more and more attractive, more and more dynamic. So try to present this answer in the body part of the answer and even in the introduction as well, right? So the data says that around 3,500 people every day die from the tuberculosis across the world. About 30,000 people are getting infected with the tuberculosis according to the World Health Organization's estimates. And in fact, India has a 27% of the global TB cases, and in fact it is a huge number. That essentially means that India has more than quarter of the tuberculosis burden. So therefore India's tuberculosis cases is a cause of concern for us, which are alarming because TB is a curable disease, right? So TB is a curable disease, there's no doubt about that, but developing resistance to the existing drugs is a cause of concern with respect to the tuberculosis. So the United Nations aims to end tuberculosis epidemic by the year 2030, and Indian Prime Minister Narendra Modi expressed India's goal of eliminating tuberculosis 5 years earlier by the 2025. So we have the goal of eliminating tuberculosis by the year 2025. So we are already 2024. So therefore we need to further strengthen our efforts to eradicate tuberculosis from our country. But looking at the burden of tuberculosis, that means 27% of the global TB cases are reported in India alone. So looking at such a huge number, it would be an uphill task for India to eradicate or to eliminate tuberculosis. In November 2023, the World Health Organization has recognized India's achievements in reducing the TB incidence by 16% and TB mortality by 18% from 2015 to 2022. And World Health Organization's report, a particular report on the tuberculosis called the Global Tuberculosis Report of 2023, has revealed that while 7.5 million TB cases were diagnosed in 2022, about 3.1 million cases went undiagnosed. So this is the main problem with respect to the tuberculosis. Most of the cases of TB are undiagnosed. So undiagnostic TB cases means that they would either receive medication at the last stages, or they may not be able to get the right medication, and that would lead to number of people would be killed by the tuberculosis. And this is a cause of concern, particularly a country like ours, because of a huge population with a poor healthcare infrastructure, particularly for the diagnostic. And the new treatment regimen that the Union government has approved for multi-drug resistant TB is called as BPA-LM regimen, right? So this would be the new treatment regimen that would be administered for the multi-drug resistant TB, BPA-LM regimen. And this BPA-LM regimen would consist of four very important drugs. So those four drugs are: the first drug is bedaquiline, and second drug is pretomanid, a third drug linezolid, and fourth drug is moxifloxacin, right? So these are the four drugs which forms an essential component of BPA-LM regimen treatment for the multi-drug resistant tuberculosis. And in fact, this BPA-LM regimen has proven to be safe, more effective, and even it is one of the quicker treatment option than the previous MDR-TB treatment procedure. So that is multi-drug resistant TB treatment procedure. So therefore, this BPA-LM regimen would be more and more effective than the MDR-TB treatment procedure. The country was working towards the elimination of tuberculosis by the year 2025, and 5 years ahead of the global target for eliminating the disease under the Sustainable Development Goals. And remember that 17 Sustainable Development Goals are there, and in fact the third Sustainable Development Goal is healthcare, adequate healthcare for all, right? So in line with the Sustainable Development Goals, Indian government has aimed to completely eradicate tuberculosis by 2025 itself. And in fact, we have when we talk about this new treatment regime of the multi-drug resistant tuberculosis, this BPA-LM regimen would be much more effective because it has a higher success rate. This particular regimen, BPA-LM treatment regimen, include anti-TB drug pretomanid in combination with bedaquiline and linezolid. And in fact, this BPA-LM regimen can actually cure drug resistant tuberculosis in just 6 months with a high success rate. And in fact, India's 75,000 drug resistant tuberculosis patients will be able to benefit from this shorter regimen, right? So since we have the objective of eliminating tuberculosis by 2025 in line with our existing sustainable development goals. So this new treatment regime that is approved by the government will certainly help us reduce the TB burden in India, right? So what is a tuberculosis? We'll try to understand some basic details about the tuberculosis. So as I have already told you that tuberculosis is a bacterial infection and which is also known as TB, and in fact, so it can be fatal if not properly treated, and TB is considered as one of often affects your lungs but can also affect other organs like your brain as well, right? So if not properly diagnosed, if medication is not properly used, so it can even infect other parts of the body, and it could even lead to the death of the infected individual if not properly treated. However, with respect to the treatment of tuberculosis, so with treatment, TB can almost and always be cured. Remember, as I have already told you, that TB is a curable and a treatable disease, and a course of antibiotics will usually need to be taken for 6 to 18 months, and several different antibiotics are being used because some forms of TB are resistant to certain antibiotics as well, right? So apart from that, there are certain challenges with respect to the tuberculosis while we are dealing with it. So what are those challenges? What are those important challenges that we usually face with respect to the tuberculosis? And remember that as per the data that we have gone through, India has 27% of the total global burden of the TB or tuberculosis cases. And challenges with regards to illness in India specifically include a poor primary health care and poor primary health care, because remember, primary health care plays a very, very important role when it comes to the diagnosis of the tuberculosis disease. Rather, we have a poor healthcare and poor healthcare infrastructure in rural areas, and that is one of the major drawback of India's fight against tuberculosis, because the ANM and the ASHA workers need to play an instrumental role in diagnosis of TB, spreading awareness about the tuberculosis, and even regularly ensuring that the patients are taking medicines. So this is very, very important. But as of now, we have poor healthcare infrastructure and a poor primary healthcare. Particularly the quality primary healthcare is one of the major challenge. And apart from that, there's also unregulated private healthcare. Unregulated private healthcare essentially because of higher expenses, or it is very, very expensive. And expensive private healthcare means that when healthcare becomes too expensive, and because of higher number of poor people getting infected with the tuberculosis disease, they generally don't seek the medical assistance because it is expensive in nature. And in fact, in India, the out of pocket healthcare expenditure is also very, very high. It would be around 40 to 52%. And in fact, in recent times, there are also HIV induced TB cases as well, and lack of hygiene facilities and widespread malnourishment and poverty are some of the other causes or other challenges of tuberculosis. And in fact, the main variables that help understand the tuberculosis transmission are rapid unplanned urbanization, lack of sanitation, lack of hygiene and overcrowding in these urban areas, and poor airborne infection control measures which are undertaken in these urban areas, poor nutrition, and HIV, diabetes and tobacco use. So all these are the major challenges with respect to the tuberculosis that we have been facing. So if we wanted to tackle, or if we wanted to achieve the TB elimination status by 2025, we need to certainly look into all these challenges, and we need to work on these challenges as well. However, there's an agenda to control TB in India, and these measures have to be undertaken to control tuberculosis in India. So in order to control tuberculosis in India, so early detection and scanning and screening is very, very important, right? So early detection is crucial for tuberculosis, because with the early detection and diagnosis of the tuberculosis, so we could actually increase awareness among the patients about the medicine, and medicine should be given on time to those patients. So it ensures a proper intervention in terms of dealing with the tuberculosis disease, right? So early detection is crucial, because very often the symptoms are often ignored by the people because a lack of awareness and some financial reasons. So however, early detection and screening would ensure that symptoms are not ignored, and screening of family and contacts of already infected individual is very important, and it actually requires accessible lab facilities and efficient follow-up systems as well to deal with the TB infection. And apart from that, there's also a precise treatment categorization, which is also very important, and this is important due to increasing number of drug resistant TB cases in recent times. And in fact, knowing the resistance status at diagnosis helps assign appropriate treatment for the disease as well. So appropriate treatment at the right time, and that means right interventions at the right time, and that would lead to dealing with the TB cases in a much more effective and efficient manner. And in fact, TB tuberculosis treatment actually requires a long duration, because remember, as I have already told you, that tuberculosis is a chronic disease, and therefore the treatment would also be a long duration treatment. So non-compliance can occur due to various reasons such as health improvement, relocation, and it is important to use technology to monitor the compliance, because once your health started getting improved, you would stop taking medicine, and that's where the TB bacteria, TB pathogen would start developing resistance to medicine, and it start developing again, and so therefore it could become more and more fatal. And in this context, it is very important that we need to regularly monitor the patients for the compliance of the treatment, right? So whether they are taking the medicine on the right time and they are taking treatment on the right time, so it is very important. So apart from that, preventing TB related deaths is also very important. So whether from drug resistant or non-pulmonary TB, it is critical. And even we should focus on controlling the drug resistant nature of the tuberculosis, because overdosage of drugs is one reason for the increasing drug resistance, and wrong medication is another reason for drug resistance, and a long duration treatment for TB is also another major reason for the drug resistance. So there should be appropriate interventions at different levels to control the drug resistance of the tuberculosis, and this is crucial as it's often caused by misuse of antibiotics and non-compliance with the treatment, and poor regulation of drug use and treatment non-compliance contribute to the drug resistance, right? So this agenda has to be followed with respect to controlling the number of or dealing with the tuberculosis in a comprehensive and a holistic manner. And the next important article, so this is also very important for your prelims examination and sometimes for mains examination also. So this question is very important. So general studies, paper 3 science and technology section, you may get this question about integrated missile development system in India, under which the Agni 5 and Agni range missiles, Agni series missiles were being developed. So Agni 4 missile was successfully test fired successfully test fired by the Defense Research and Development Organization, right? So India's strategic missile, which is Agni 4, was successfully test fired from the Abdul Kalam Island in Odisha, or Abdul Kalam Island was formerly known as a Wheeler Island off the coast of Odisha, right? So in fact, so we all knew that Agni 4 missile is a surface to surface missile, and it has registered the third success in a row. Earlier flights were November 2011, September 2012, and a series of such tests were earlier also conducted, right? So it is a strategic missile and that can carry 1 ton of nuclear warhead, and in fact this missile can target locations within the 4,000 kilometers away, and it has the longest range after the Agni 5. So Agni 5's range is 5,000 kilometers. So you could actually see the range of different missiles that we possess in India. So India can now design any missile for any mission based on the threat profile, right? So these are some details with respect to the Agni 4 missile, and some basic details about Agni 4 missile is that it is an intermediate range ballistic missile, and the launch of Agni 4 was carried out from the integrated test range in Odisha's Chandipur, so which is also known as Wheeler Island or Abdul Kalam Island. The launch successfully validated all operational and technical parameters with respect to this intermediate range ballistic missile of Agni 4, and it was conducted under the aegis of a Strategic Forces Command, and this Strategic Forces Command is part of the Nuclear Command Authority, which is also known as the NCA. So this is very, very important that you have to remember. And there are some features of this Agni 4 missile, and Agni 4 missile can actually hit the targets as far as 4,000 kilometers, and much of China would be covered by the Agni 4 missile. And apart from that, the 20-meter long missile can actually or usually carry a payload of 1000 kg and can be fired from road mobile launcher as well. It is a surface to surface missile, and it is a mobile and 2-stage solid fuel system. So Agni missiles are designed and developed by the Defense Research and Development Organization, DRDO. So these are some basic details with respect to the Agni 4 missile, right? So these details are very important because in recent times questions based on these missiles are also being asked in the prelims examination, so you just remember these details. And today we have one mains practice question. This is a very, very important question with respect to fiscal deficit, and previously also there were questions on the fiscal deficit from General Studies paper 3. Okay, so today also there is an article in the Hindu about the fiscal deficit, right? So because of that reason we have framed this question. The question is, what is fiscal deficit, and what are the impacts of fiscal deficits on the economy, and what are the ways to financing the fiscal deficit, and also suggest steps for fiscal consolidation in the light of the union budget proposals. So this is the question, and before answering the question, it is very important that first and foremost you need to structure this question, because the structuring will gives you a proper flow and coherence to your answer, right? So the structuring is that first and foremost it is very easily asked, right? So structuring of this question is very easy because first you need to write what is fiscal deficit, and then you need to write the impacts of fiscal deficit on the economy, and then you need to write what are the ways through which a fiscal deficit can be financed, and then you need to suggest some steps for the fiscal consolidation in the light of the union budget proposals. So this is how, in a very simple manner, you could actually structure this answer. And based on the structure of the answer, fiscal deficit, you need to briefly define it. So fiscal deficit is a term which is being used to denote a deficit in the government earnings during any financial year, right? So what is a deficit? We need to understand a deficit first. Deficit. So deficit is simply the difference between the total revenue minus expenditure. Okay, so the difference between total revenue minus expenditure is considered as a deficit. So therefore fiscal deficit is a term which is being used to denote the deficit in government earnings during a particular financial year. And the fiscal deficit occurs when total expenditure, So this actually or usually occurs when total expenditure of the government usually more than the total revenue of the government, right? So that's how the fiscal deficit would come into existence, and that would result in fiscal deficit. So I hope you have understood that. No, imagine I would explain this in a very simple way, that total expenditure of the government in a financial year would be around 1500 rupees, right? So in a very simple way. However, the total revenue of the government would be just 1000 rupees. So revenue is 1000 rupees, but government's expenditure is 1500 rupees. So therefore government has to borrow 500 rupees more to finance its expenditure needs, right? So that's how fiscal deficit is being created, right? However, you need to exclude the government borrowed funds from this, right? So fiscal deficit is reflective of total borrowing requirements of the government, right? So that is how you can write the introduction briefly about the fiscal deficit. Now we'll try to understand what is the significance of fiscal deficit. In any economy, there's a limited pool of investable savings, right? So savings are very important because savings can be channelized into investments, right? So investments are very important because investments would create employment opportunities. Investments would result in economic growth, economic development, and increased exports. So therefore in any economy there is a very limited pool of this investable savings, and these savings are usually used by the financial institutions. Very simply, what are these financial institutions? Bank is a financial institution, right? So we regularly see bank, and bank is a financial institutions, and we also knew that banks usually lend funds to the private businesses. So small households would save some money in these banks, and banks would lend money to the private businesses. So they include both big and small business individuals, and even the governments as well, center and states as well, because governments also require money, right? So government issues sovereign bonds and then borrow money from the financial institutions, right? So therefore these savings are used by the financial institutions to lend to both private individuals and also the government as well, so that they can earn certain interest rate. However, if the fiscal deficit ratio is too high, or if we have too much of a fiscal deficit, so it generally implies that there's a lesser amount of money left in the market, right? So there's a very less amount of money left in the market for the private entrepreneurs and businesses to borrow. So because the government would borrow more and more money from the economy, so that makes the private entrepreneurs and businesses would have a lesser money to borrow, and a lesser amount of this money in turn would lead to the higher rates of interest charged on such lending. Even if financial institutions wanted to lend money to these private entrepreneurs and even businesses, they used to charge a very high interest rates. So simply put, a higher fiscal deficit usually means higher borrowing by the government, and which in turn mean a higher interest rates on the economy, and that would lead to the slower economic growth, economic development, and even that would lead to the economic recession as well. And that's why fiscal deficit is a very, very important, and that needs to be taken into consideration, right? So in this context, what are the impacts of fiscal deficit? So we'll try to understand the impacts of the fiscal deficit as well, right? So in fact, fiscal deficit means that government is spending money on certain unproductive sectors. Unproductive sectors in the sense that there are certain sectors, even if government invests in those sectors, so those sectors will not give any profitable returns to the government. So higher fiscal deficit for the government means government has been spending money in these unproductive programs which do not increases the economic productivity even in the long term as well. So for example, Mahatma Gandhi National Rural Employment Guarantee Act, and most of the money is eaten midway by the sarpanch and local officials as part of this Mahatma Gandhi National Rural Employment Guarantee Act. So you could also write such examples in the answer, because when you write such examples it creates a good impression and you would also get good marks for your answer if you write such examples. And then government borrows from the Reserve Bank of India, and because of a higher fiscal deficit, so government has been borrowing more and more money from the market, and there's a lesser money, and if there's a lesser money, then there will be higher interest rates would be charged on the money which is in the economy. So therefore government also borrows money from the RBI. So if this demand increases, what RBI will do? RBI will start printing more and more money to meet the demand of the government. So it is called as a deficit financing. RBI printing money to meet the currency demand of the government is known as the deficit financing, and it would result in circulation of more money in the economy. And we all knew that when more money is being circulated in the economy, and that would create inflationary pressure in the economy. So that would not be good for the economy, because that would create inflation, and inflation either directly or indirectly would further lead to the poor economic growth, economic development, and even economic recession as well. And when government started borrowing continuously to fill up its fiscal deficit pothole, then the bond yield will also increase, and it is not good. Increasing bond yields will not be considered as a good sign, because more and more taxpayers' money, so government's incoming money, will go in repaying that bond interest rates rather than going into education and healthcare. So for government it would not be a good sign, and government may even be compelled to borrow to finance even interest payments, leading to the emergence of vicious cycle and even debt trap for the government. And fiscal deficit would also lead to the crowding out investments from the private sector, as government started borrowing more and more money from the economy. Now crowding out of the private sector would means that private sector investments would slow down, and economic growth would slow down, manufacturing would slow down, and lesser number of exports out of India, and India would become an import dependent economy. And there's a huge unemployment, because gainful employment opportunities are not being created because of a poor private investment in the economy, right? So there are certain strategies, and those strategies can be used to reduce the fiscal deficit as well. And in this context, there is a need to implement N.K. Singh committee recommendations with respect to fiscal deficit for a stable economy. And in fact, the N.K. Singh committee has suggested that a fiscal deviation band of 0.5%. Right? So this essentially means that government can deviate from its fiscal deficit target by 0.5% from the fiscal deficit target if the economy is actually slows down. And in fact, on the other hand, when economy is doing well, the country has been performing well in terms of economic parameters, the deficit can be compressed by just 0.5%, right? So this is what the N.K. Singh committee has recommended. Now apart from that, a tax base should also be broadened, and when a tax base is broadened, government would get more and more taxes, and therefore it would eliminate the need for borrowing more and more money from outside from the market. And even concessions and reductions in taxes should be further curtailed, and tax evasion should be effectively checked, and more emphasis should be placed on direct taxes to increase the revenues, right? So these are certain strategies that can be followed to reduce the fiscal deficit. However, the government should over a period of time try to minimize the fiscal deficit, right? So that is very, very important for the economic sustainability in the longer term. And that's all in this lecture, and thank you so much. So if you like our work, please subscribe our YouTube channel and also hit the like button. Thank you.